Welcome to Behind Our Health Life podcast, a podcast about things that matter the most, our health. A healthy life for our citizens, youth and children alike. We need to reimagine, restructure the healthcare policy and a system that will protect our nation and Africa as a continent. Our lives begin to end when we become silent about things that matter to us.
Hello, my son guys. My name is DJ Country, aka Mr. Shat Boy. You are welcome to our podcast. I'm here, not alone though, and I'm guys winangoku.
You can never be alone.
No. I'm guys sawa neka bwino maningi.
It's okay.
Kubiyangana kuzaona sia to the problem.
Yeah.
I think as I start introduce come guys.
Thank you very much. That's Love More DJ Country there. My name's Patrick Majidi Kazadi.
Okay, so that being said, you're welcome once more to our podcast.
Yeah.
Our podcast is called Behind Our Healthy Life. Yeah, Behind Our Healthy Life. So what are we talking about? Nabotangala pants. A guy, you know. We started looking at the healthy
situation.
Yes, the health situation in our country. The way my health facilities many halidi, my conditions ya metima pitamo ngati taenda kufipatala. How difficult it is to access mankwala, how difficult it is for you just to be attended to, how the health workers talk to us,
the treatment.
How, yes, you know, how sometimes you are there and you don't get even mankwala anywhere in there.
At times not even the attention.
Even the attention, you know.
Yeah, the whole day in the queue.
Yes. Yeah. Even the deaths, you know. The number of deaths in our communities, you know, like we really went deep, you know. That guns up bad. So we thought we should bring up or we should create a platform where we can start discussing these issues, because at the moment we don't know what really causes all of this, because what we have at the moment are assumptions. So we thought, why not come up with a platform where we can discuss these issues, where we can bring everyone, you know, to come and speak their experiences, you know, speak their minds, you know, speak their opinions, you know, and also bring the professionals, you know, they come in from the government, from the hospitals, you know, they also speak what really happens, you know. We don't know why Maneswa Mashauta. So.
Yes. And also we just don't know what happens. Hence it's behind our health, because we want to talk about things that people don't talk about. We also want to hear they just complain, and could be you know, someone would be in hospital for months, you know, start research, you know, and then then they leave the hospitals very frustrated. Some they lose relatives there. Hospital, they never know what happened, you know, and they've got nowhere. So I thought it's just okay to bring this platform so that, you know, let's share our experiences, and who knows, a problem shared
is a problem half
solved. So
so this is what this podcast is all about. We are trying to iron out these issues. We are trying to find a solution. By the end of the day, we are trying to see what really can be the solution to this problem, you know, and that can only happen if we all open up, you know. And we are also looking at trying to bring in like other solutions, other alternatives. Because nowadays in Adwala, the only thing we think about is kwenda ku hospital.
Kwenda ku hospital. That's the only thing that we know anyway.
But there's a lot of other things that we can do. For example, ungaende kuchurch right now pempela.
Olongaende kunganga.
There's a lot of papas out there. With all respect, you know, there's a lot of good men of God there, powerful men of God there, you know, that can
even
help
witch
us.
doctors.
There's also kulinganga.
Anaenda mgaiza pora kunganga kwa mpanga panga. So that's our traditional way of thing. You know, way back, that's how we think our parents used to do it. Not only thinking, but I think that's how it is. And just to add a disclaimer, DJ Country, we are not here to attack anyone.
Yeah, sure.
We are not here to shoot at anybody. No. We are not here to say you are bad, you are good. No, we are just trying to raise our concern as concerned citizens.
Yes,
so
exactly.
We are just here to make sure that, you know, we also hear from you people. Hence, it's going to be a podcast for everybody.
Yeah,
despite where you are, regardless of the distance, kumunzi, kutauni, and in fact, those people wako munzi ndio afunika na maningi because there is a longest distance for them to just, you know, find a health sector or a clinic pamunzi.
Health facilities very difficult.
It's a challenge for those people.
Very, very difficult.
At least some of our friends, they fly. Anaenda kusao bay. Kaida dora kote kamoto.
But for those very kumunzi, it's very difficult. Very, very difficult.
True.
And the other alternatives that are there also, there's herbalists. You know, there's herbs. There's these guys now. I'm town.
Yeah.
In fact, they're everywhere. These guys, they even use those megaphones.
Megaphone. 7 Wonders.
Yeah.
Have you used 7 Wonders before?
I almost tried.
You almost tried.
And then somebody.
I want to hear about that. I'm about to do that because this guy is like but
I'm still trying to.
I would want to use that.
I think the best thing I can do right now is just to go and have a talk with them.
Have a talk?
Yeah.
Not give it a try. I want to buy 7 please. Want to our listeners, our viewers. Ngamuzi wako muntu wagurisa 7 Wonders. Please direct them to Patrick Majidi.
What does it do?
I want to know.
Like
but I have an idea. You're not going to sleep. You'll be active all night, and you know we do a lot of work.
I really want to understand the part of the
sleeping part. The wonders. Imagine
the
7 wonders. So it's like 7, maybe 7 rounds of wonders or something. Please, can somebody let me know? We know you are out there. You've used it before. Yes. Those are herbs, right?
Yeah. So those are herbs. You know. So there's a lot of alternatives out there that we can really use, you know, because what we've discovered, I think we can all agree with us that the fact many of team hospitals specifically changes because queues there's a lot of people there if you go there, so meaning the clinics are congested, you know. So we'll be looking also into all these alternatives. We'll try to bring in witch doctors. They explain, because the witch doctors Majidi,
and I always want to understand what's the difference between a witch and a witch doctor.
A witch and a witch doctor.
Mfuiti na nganga.
I think paliko umonzi impondo. I think nganga izakalonderola.
Because at some point I would want to prefer between one, maybe ningasankepo umozi, but I want to know.
Izakalonderola nganga. I'm really interested because I think the difference is minimal though. It's very small.
Okay, that's why you want in a witch. They start with witch. There's a witch and a witch doctor.
Yeah.
So can a witch doctor heal a witch?
Oh boy.
I want to know because I've been there. You know, I've been in positions where mankola hospital yakanga suna pole, kuchechi wakanga. You know, boy enda kunganga rina pola. In fact, wanganga tiwamoza before you enter kuza kudara vyo lina hapa kuza nje. You adola mutu, they already know. So I'm like, dude, how do they know? Is it magic or
I'm really also interested in that. I'd really love to.
So please, our listeners, stick around with us. This is your podcast. There is more that we are going to learn together, and there is more that we know that you would want to share. We have lots of people with a lot of stories out there, different experiences that they would want to come to come out. They would want people to know how they struggled to access medical, medical services, how they struggle just to buy it. Because at some point, when the kuchipatala, then and these guys, they've got ugliest handwriting ever. sorry, health sector people, you've got bad handwriting.
I don't know what to call it though.
They wrote me something, that's a prescription. I couldn't read it. And now boss, I'm like, dude, now you're asking me? How do I know that? I can't see.
Yeah, I also, now I actually remember, I also had an experience once. I went to the hospital, the clinic actually. So they gave me a prescription. Then I went to the pharmacy. Actually, I went to a private pharmacy. Okay. So there I gave the guy the prescription. And then he was like,
you couldn't see?
I can't see what
you
guy wrote. You have to go back. And I was like, dude, I'm sick.
For me to just get this prescription, I was there for the whole day.
Yeah, I can't manage to go back. And he was like, okay, looking at the other prescribed medicines here, maybe this is what
this looks like
anyway,
B.
Yeah, but that's the thing. The handwritings are something else.
They need to work on that.
Okay, so the reason why we decided to do a podcast, not take this on radio or TV, it's because we want to be free. Yes, we want everyone to be comfortable. We want everyone to be like themselves, to express ourselves in the best way possible. We don't want restrictions. I think this is a good platform for everyone that has things in their chest that they want to bring out, about this issue of health. So our audience, you're welcome.
Please.
Yeah, you're welcome to participate. Come through, please. We are going to make sure that we bring each and everyone on this platform
together.
You are welcome to come here. You're welcome to come and speak out your experiences, what you've gone through. So that out there, running and away via my facilities, healthy. They can understand what we.
They can learn from us. And it's behind our health. And this is a very, very good title to give it, because these are things that we never pay attention to. Ukalangana kumbuyo uyopa usanduka soti mwangazi wa loti. Kulbewa ya kambabo, because ufuna kai ukalangana kumbuyo, even if ulanganeko, there will be nothing. So for us, we want to cover that gap. We want everyone to come on the same level and be with us, and feel free. Na utikamba vizungu hivi, don't worry. Ungabo kamba chinyanja, ungabo kamba tivemba, ungabo tilozi. On your screen, you're going to see a WhatsApp number that will be just crossing there. That's the WhatsApp number that you'd want to send your voice note. You'd want to feel free. You always come as anonymous, unless you want to appear like we're going to be inviting. We'll be hosting some guests here. So then, if you are okay, you feel like you're confident enough, like we said, feel free. This is yours. You can appear. But if you feel like, you know what, I want to contribute, but I don't want anyone to know me, I want to be anonymous, please, you can send us a WhatsApp message, a WhatsApp voice note, and we are going to express your concerns on your behalf.
Yes, exactly. Okay, so that being said, we think what would work, how this would work, is when we share our experiences first, because that's where the truth lies. You know? So
I've got the baddest experience. You wanna hear my experience?
Yeah, I think
my experience was the worst. So
okay, so before you tell me your experience, first I have a question. What do you think of our health sector? How
it's pathetic.
Really?
It's bad. It's the worst. But
they are trying, man.
What is trying?
They have built like hospitals.
They've built what?
Hospitals.
Hospitals where?
There's new hospitals. They are calling them.
Those are the only hospitals that people can afford. They are those people that they are zero way. They have zero way. Not even upon our health insurance, they are not there.
So you are saying
they can't come to Lusaka. They don't even have a transport. It's not enough. Look, imagine this person from this, probably a woman. Let's me pick a cervical cancer woman from Shangombo.
Okay.
Do you want them to travel all the way from Shangombo to UTH?
Why did you
with
pick
what
Shangombo?
money? I've been there.
I feel like there's an agenda.
I've been there. I've been to Shangombo. I know the distance. I know that journey. I know that gravel road, man. I know that experience from Shangombo to Lusaka. Whoa! And you tell me that they built. Can they take a UTH to Shangombo, please? then I will love that. Yeah, I mean, this is just me.
Okay.
Okay, anyway, so just talking about the biggest, obviously, hospital in Zambia.
Okay, so
I've been there.
Okay, so you think it's not good enough?
No.
Okay, tell us your experience.
It doesn't even
one of
your
experiences.
All right, good. So first thing,
like what really traumatized you like that?
Yo, first thing, I lost my friend May, so rest in peace.
Oh,
okay.
Sorry.
He really suffered.
Okay.
Right, and we buried him without even knowing exactly what was the problem with him.
When was that?
That was like 4 years ago.
Okay.
And he was very sick. Okay. So it started very simple, it's headache, and all of a sudden there's some things on his skin appearing, and go to a clinic. And he used to refuse to go to the clinic. I've been to a clinic when I was seriously sick with malaria, and there's nothing that they're going to give me, so I can't go there. We forced him, like, dude, go. And he went. Do you know what he came back with? Panadol. Okay. And then what was that? There was another painkiller, whatever it was like two medicines. Panadol and some medicine that I've forgotten, it's been a while.
Okay.
And we're like, yo, and what did I tell you about this skin? And they say, no, it's just an allergy, Visapol. Yes, and we all became comfortable. And the allergy problem, guys, it's okay.
Did you go to the lab?
No, there wasn't something like that. Until now, it became worse. Now, those things started coming out on his skin, the hand, the neck, and on the face. And like, you know what, dude? I think we're going to do it and the clinic.
Okay.
So he went back and was sent to UTH. Okay. And kufika ku UTH, bampasa na nkwala, yo zola, yo samba, yo kumwa, which we thought like it's okay. And all of a sudden this guy got like serious sick. Went to UTH and they gave him a bed. I think it's kusunga kono.
Okay.
And bamba kumulasa chemotherapy. That's chemo. Yeah. Bamba kumulasa mu guys. Without even knowing to say, okay, so kapeno ina cancer ya so, idipa level ya so, maybe yankala this long mutupi, and maybe uzafunika so, even afika se kulanga na zaya ini cancer. Chemo.
Oh my God.
And that was the first time that I knew that injection is painful, man. Oh, chemo? You don't want to test it.
Really?
I know there is a...
How do you know that it was really
because
painful? I
I was there. I could see how he would cry like a child.
Really?
After that injection. I saw it. And he would cry. It reaches the point where he would refuse to say, Osanilasa. Guys, when he was having it dual.
Yeah.
And we're like, no. Wakambati, I think ingankale cancer. Because that's why they say that we think ingankale cancer. So we think.
But how do they say
not sure to say in a cancer?
Why didn't you question to say, how do you say we think? Because they're not there to think.
They are there to actually tell us what is the problem. Exactly,
Yeah.
And we waited for the result. Oh, my result boy. That's what we can be sure. We waited. But he kept receiving that injection.
Okay.
He stayed in UTH for like 3 months. Yes, okay. For like 3 months. You know what happened? All of a sudden, I'm going to visit this guy to the hospital. He's not there. He's home. He ran away. Went back home. And me, I followed him home. I was like, dude, you can't do that. And he was like, no, my girlfriend said we're going to church. You can't do that. Like, no, we're going to church. At Wanani program.
Oh, okay.
Who told you that? They didn't tell him anything. So even him, he wasn't sure.
Okay.
So he preferred going to the church.
Okay.
And church serious. Then they had to take him back to UTH. And that's how he died. Because when he went back from church 7 to ways. In fact, to ways. So he only stayed like for 2-3 days in hospital. Then he died with his facial expression to show that it was a painful death. Yes, we had to find a way to close his mouth. We had to find a way to massage his face so that at least it can look like, this person. So for me, I was like, dude,
that's really sad,
we've lost somebody who, even Pamariro Park, we didn't know what to tell the people. Chamupaya ni chan.
Okay. So, according to you, what do you think was supposed to be done?
What was supposed to be done?
To save his life. Yeah.
Now, get this from me. I'm not an expert in health. I said I'm a theater arts practitioner. That's my expertise. But I have an idea because obviously, you know, the first thing I think they would have done was to make sure that they do as many tests as possible to be sure. If they knew that this is out of our hand, they would have recommended somewhere to go.
So you are trying to tell us here that there was no time where they came and told you to say, okay, these are the results.
These are the results.
And this is
the sickness, and it's been in this body for this long, and the palevo paya fika. Because I wouldn't have even brought it, because that would have been more helpful. I remember stopping a nurse and asking her, and she gave me a very blank answer. Say, me, I'm not the doctor. Me, I just come and give him the medicine that is already written there, because there's this kamafao bedside.
Okay.
So if you are working in the night, you just reach there and so ampasa ko ingati yaso, okay, so inenza mpasa yaso naso. That's what she do.
Okay.
And so she had no answers for me, and I kept waiting for it. And guess what? The doctor would be almost 3, 4, 5 days. But the doctor will only come once and check and get their temperatures and check them on. Okay, I think add the dosage. Or you can put the dosage. Yes! And off it goes. And because we were so busy, all of us who can really question the most, and there was only like ladies who bedside. So every time we come out, doctors wanna come every once. And maybe you're reaching the hospital, because after you knock off that like 15, 16, you reach the hospital and all the doctors have already knocked off. At some point I had to wait. I'm saying, I want to see the doctor. I waited, and the doctor never came.
Really?
Yeah, and still there somebody came and gave him the chemo.
Okay.
So you're telling me that
that's dramatic.
There's no problem? There's a big problem. We need to fix that gap.
There's so much drama in what you're
I have a lot of
telling us
experience, man. Do you need more? I have a lot, but I will leave this for the next time.
Okay, so like my next question is okay, so don't you think the government to some extent is trying also to help? Maybe there's certain things that we don't understand as for now, like hiccups, like things like things to work properly.
I think that's why we're gonna need one of them or 2 or 3 of them to appear on this podcast.
As you,
because as me, like I said, we don't want to shoot anybody, we don't want to attack anybody, but I would say, the government, they make this whole national budget.
Okay.
So if they're trying, I think they can do better.
Okay.
If they are trying, if they're going to say, you know what, we are trying, we are doing our best, I think there is more that they can do that can be their best as a government.
And how can we address that issue?
So for me, the way I can address this issue, I would first want the government to just take this as a number 1 priority, man.
Okay.
We're talking about health.
Okay.
You are not health until you are health.
Yeah.
Exactly. And for me, I would want the government to make sure that, in fact, the budget number 1, health.
Okay.
They want education. Can you go to school if you're not healthy?
Yes, you can.
When you're sick?
Yes, like Mutu.
Oh, Mutu. Okay, so we can take you pa stretcher. Or malaria serious. Take stretcher education first. Even the stretcher is found in the hospital. So health should be 1. If I would do something for me, I think I would want the health to be the first thing.
Okay. As a
first,
priority. Okay.
Number 1 priority. Yeah.
Okay. I feel bad for you.
Tell me about if it was you.
Yeah,
what would you do?
your experience is very sad.
Yeah, man.
With your friend, and what is very sad is that because in the sense of story is Africa what
Anafa. Oh.
And Zona Mungati, as usual, because we all have these experiences, but we thank God that it's a Kalipo.
Yeah, true.
But your story,
yeah.
Okay, so this is why this podcast is here.
Exactly.
We are trying to make everyone come here and really express themselves so that the relevant authorities can get to know about what we go through. Maybe not every Swazi,
who knows?
Maybe no one knows to say this is what happens on the ground.
True.
Yeah, maybe they know. Maybe
they
by
don't.
So this is really good that you've opened up.
Yeah.
We hope you open up more in our next episodes.
Please.
Yeah, I also have experiences that I would love to share with our audience. Yeah, but maybe later. Yeah. So please, everyone, come through.
Please.
Feel free to join us.
This is what we are talking about.
This is your platform. It's created for you and us. It's not only for us. We are really looking forward to have a lot of confessions here, a lot of experiences explained here. Tiembekeza, and then we are going to make sure that we do this as professional as possible. That we don't attack each other, but try to make sure we have a solution here.
So
tizambo later my audience tizambo later, you know, banzambo later konzambo later bantu experience, zambo later bantu bamene basenza ma clinics, zambo later bantu nasenza ku ministry, zambo later bantu ngati ma alternatives like pastors, zambo later bantu ngati my solutions like my witch doctors, zambo later bantu bamene bangati my remedies that we can use at home, you
like
know,
it's
not every time that you are not feeling well, we should go to the clinic. You know, we can take care of ourselves. Kunyumba kwa menu. So we bring them in so that they also share. Then he said we are on all platforms. We are on TikTok. We are on YouTube. We are on Facebook. We are on WhatsApp. We are on Instagram. We are everywhere. Just go and search for Behind Our Health Life. Mzati pesa then imwamini mfumo sta communicate nice ameni number ameni pita pa screen
please
ndi number you're using then mbenango you can just send us your experiences there. Then itizambo yaberenga pano pa podcast so people can listen, people can understand and learn, because it is not everyone that goes through
these challenges
that we go through. Kambiri physically ndise bamene akwati sister bwino maningi ndi physically ndise timakangiwa because abanzatu wenango they can afford
they can
fly to India,
kandeke baenda
they can fly to where they can go to my private clinics,
not kandeke akuti abantu ati kamba ndeke. And also just remember that don't just complain without a solution. We need you to express yourself, feel free, but at the same time so give us ideas, because ungaziona mungati badadi wazave vishtika pa nyumba but ngasimu bauza dadi they might never know. So tingaziona mungati abaviziba even to kanzi they don't know, so maybe they need someone to tell them. So please ozango bulache kudandaula ine wananipisha clinic mailo bwanji tuze wanakupisha ne so mona monga nchanje tinga chiti so next time wasaka kupishana, you know, bring your solutions and ideas.
But osambera manta futi kukamba vale mnapitana tunikutiuza so that together we find a solution.
Makamaka ba handwriting ngati simunaone maningi ba handwriting nikutiuza tizawatandisa
we have issues na handwriting
simaoneka
really.
Wanzatu walimonga wakapokola so they learn how to slap, where to slap, who to slap, when to slap. So choneka monga silapo handwriting. Akonza that when to give Panadol, who to give Panadol, how to give Panadol, you know. Handwriting is like how to write a prescription.
And I think handwriting zaide mba somewhere.
Take notes.
There's a doctor.
Akatuze please. Kapena handwriting is part of the course.
Maybe yakati kulemba vo bisika so that patient asaone kuti mumpasi mankolo yompaira oyokole. Anyway, that's a joke.
We know.
So zinayanga in the DJ country like I said,
and me Patrick Majidi
tabula class kwa program yatu. So a guy
Mazmai
Midala Bambo
Makamaka wazibambo eti mapoenda kulidi kaya zako nyoza kutati iwe nangani chanchiri mutrauzichi.
Then kai kulina ya matenda zasa discuss bwino but kuna matenda kwa twakadwala wanyanyamata makamaka amevera nsoni kuulula kutine pano mkati umwasi
simudi bwino wewe simudi 7 wonders.
Yes, 7 wonders. Okay, so sikomo kwambiri. See you next time. We are hoping to hear from you. Let's all come together to work on this, so to make sure that this understand the solution to vote native votisatons. Sikomo kwambiri, until next time.
Thank you. Bye. Nigga, come back.